So coffee is your go-to. Are you a breakfast gal? Do you like to eat breakfast? No.
I do not eat breakfast. This is breakfast. I've been going to Taylorville as many years as I've been in practice, and we like it because it's a little bit quieter down there. We're kind of in our own little area. It's just so nice for the patients because it's much easier for them to get a ride, and they don't have to travel as well, get up as early. If I didn't enjoy my job, then I probably wouldn't want to do it anymore because there's, a lot of time away from your family, a lot of hours that you don't sleep, especially being an OB. It's very disruptive, but, I get a lot of satisfaction out of what I do. It was actually the last thing I wanted to do. I still was saying that my first week of my OBGYN clerkship, it was my last rotation of my third year. They showed us this horrible film. It's like black and white of this woman screaming, having a baby. I'm like, there is no way I'm ever going to do this. But in the end, I ended up liking it. Not the screaming part, but being there when a new life comes into the world and the joy the parents have, and it's beautiful. And OBGYN gives you the opportunity to see people in the whole gamut of life. And I really enjoy surgery. I never thought I would like it, but I really enjoy surgery. I feel like I'm good at it. It's just a nice mix. It's hard to be bored because there's always something new.